Alright, quick reset for a second. Let's talk about your kidneys because this is one of the most overlooked health problems people face. Most people don't find out their kidneys are in trouble until they've already lost 60 to 80% of their kidney function, and by that point, the damage can be very difficult to reverse. Here's what makes this especially tricky. Your kidneys don't have pain receptors. That means they usually can't send pain signals when something starts going wrong. So kidney disease often develops quietly in the background for years. But your body still sends signals. They're just subtle. So today we're going through 10 signs your kidneys may be crying out for help, plus one warning sign that can show up suddenly. Let's start with the one sign that is loud and obvious: kidney pain. Most kidney problems are silent, but in certain situations pain can appear. One common cause is kidney stones. Kidney stones are small crystal-like structures that form inside the kidneys. While the stone is still inside the kidney, you usually won't feel anything. But once it moves into the tube that connects the kidney to the bladder, called the ureter, the pain can become extremely intense. Many people describe kidney stone pain as one of the worst pains they've ever experienced. The pain often comes in waves. That's because the ureter repeatedly squeezes, trying to push the stone forward. The pain can also move downward as the stone travels through the urinary tract. Other symptoms may include urgency to urinate, burning during urination, blood in the urine, nausea or vomiting. Kidney pain can also come from kidney infections, which usually cause deep aching pain along with fever and chills. Another possible cause is polycystic kidney disease, where fluid-filled cysts grow inside the kidneys and slowly stretch the kidney tissue. But remember, pain usually happens during acute problems. Most kidney disease develops slowly and silently. So now let's look at the quieter warning signs: fatigue and brain fog. One of the earliest symptoms people notice is persistent fatigue. Healthy kidneys remove waste products from the blood. But when kidney function declines, substances like urea and creatinine start to build up. These waste products can affect the brain and nervous system. As a result, people may experience low energy, brain fog, trouble concentrating. This type of fatigue often feels different from normal tiredness. Even after rest, the body may still feel drained. Puffy eyes and face in the morning. Another possible sign is puffiness around the eyes, especially after waking up. This happens because damaged kidneys can allow protein to leak into the urine. One important protein is called albumin. Albumin helps keep fluid inside the bloodstream. When albumin levels drop, fluid can leak into surrounding tissues. During the night, when you're lying flat, that fluid redistributes through the body. That's why swelling often appears around the eyes and face in the morning. Swollen feet and ankles. Fluid retention can also show up in the lower body. Many people notice swelling in their feet, ankles, or lower legs. This happens for two main reasons. First, loss of albumin allows fluid to move out of blood vessels. Second, damaged kidneys may have trouble removing extra sodium. Sodium holds onto water, so when sodium builds up, the body retains more fluid. Because gravity pulls fluid downward while you're standing or sitting, swelling often becomes worse in the evening. Changes in urination. Since the kidneys control urine production, changes in urination are another important signal. One common change is frequent urination at night, called nocturia. Occasionally waking once at night can be normal, but waking up several times every night may indicate a problem. Other changes may include producing less urine than usual, dark or cloudy urine, stronger smell in urine. Any persistent change in urination patterns should be taken seriously. Foamy urine. Another warning sign can be persistent. Foamy urine. Urine can naturally produce small bubbles when it first hits the toilet water, but those bubbles should disappear quickly. If foam stays on the surface for a long time, it may indicate protein leaking into the urine. Doctors often measure this using a test called the albumin to creatinine ratio. Creatinine is normally filtered out by the kidneys. Albumin should stay mostly inside the bloodstream. If albumin levels in urine rise, it suggests the kidneys may be leaking protein. Visible foamy urine is usually a later sign, but laboratory tests can detect this problem much earlier. Itchy or dry skin. Kidney problems can also affect the skin. When the kidneys cannot filter waste properly, certain minerals and toxins begin to accumulate in the bloodstream. One example is phosphorus. Elevated phosphorus levels can lead to itchy or dry skin. This symptom usually appears in more advanced stages of kidney disease, but it can still be an important clue. Anemia and feeling cold. Kidneys also play a key role in producing red blood cells. They release a hormone called erythropoietin, or EPO. This hormone signals the bone marrow to produce red blood cells. Red blood cells carry oxygen throughout the body. When kidney function declines, EPO production may drop. This can lead to anemia, meaning fewer red blood cells. Common symptoms of anemia include feeling cold, shortness of breath, fatigue, pale skin. These symptoms occur because tissues are receiving less oxygen. High blood pressure. Kidneys are also responsible for regulating blood pressure. They control the balance of sodium, water, and hormones that affect blood vessels. When kidneys become damaged, they may retain excess sodium and water. This increases blood volume and raises blood pressure. Unfortunately, high blood pressure can also damage the kidneys further. So the two problems can reinforce each other. That's why managing blood pressure is one of the most important ways to protect kidney health. Metallic taste and ammonia. Breath. When kidney function declines, waste products accumulate in the bloodstream. One of these is urea. Bacteria in the mouth can break down urea into ammonia. This can cause a metallic taste in the mouth or ammonia-like breath. Brushing teeth may not remove this taste completely because the problem originates from waste products circulating in the body. Some people also notice reduced appetite when this occurs. Poor sleep. Another symptom that often surprises people is poor sleep. Kidneys help regulate the balance of important electrolytes such as sodium and potassium. When this balance is disrupted, it can irritate the nervous system. This may lead to difficulty falling asleep, restless legs during the night. Restless legs create an uncomfortable urge to move the legs, which can make sleep even more difficult. Poor sleep then worsens fatigue and overall health. Kidney problems rarely appear overnight. In most cases, damage builds slowly over many years. That's why recognizing early warning signs is so important. Pay attention to changes in energy, swelling, urination patterns, and overall health. Regular medical checkups and simple lab tests can detect kidney problems long before symptoms become severe. Your kidneys quietly filter your blood every minute of every day. Protecting them is one of the most important steps you can take for long-term health. If you found this helpful, make sure to like, share, and subscribe for more simple, practical health content.